secret to keep you looking young and beautiful. We don't mean young if you're 50 you want to look 20, or if you're 60 you want to look 30. We just want you to look the best you possibly can, because everybody's issues are universal, and we're going to show you why they're universal as we're aging along. So when you look at a baby has a tiny little skull and plenty of volume all over the place. It's got fat, it's got collagen, and it's just got so much skin compared to this tiny little head that it's got. So that's why they look so nice and full. Then if you look at a teenager, you can see that the fat has decreased a bit. The skull is catching up with all the material that he had in there to make it look still very smooth, because there's a lot of fat under there. It's still real healthy collagen. Hasn't had time to damage it yet, like we've all done throughout years. So the face still looks completely soft and completely smooth. And if you look at an adult, now you can see that more collagen is going, more fat is going, and the muscle movements that we make are starting to kind of adhere to the skin, so that's why we get more prominence, we get a little bit of loss in here. And I mean, she still looks very fresh, she still looks very young, but these are the things that are happening and just keep continuing as we go. So there's an older adult. You can see that everything is just progressing. These little marionette lines are getting bigger, the jowls are getting bigger. Depending upon what you do, if you do a lot of sun, you're going to be there quicker. You're going to have a lot more degradation to your collagen, to your fat underneath your skin, just to your health in general. And then if you add smoking, obviously it's going to be pretty bad. But you can see how he's got now, his skull's starting to shrink again. Now he's got too much skin, and it's just kind of falling along, and he's been helping along with sun and smoking too. So what are we losing as we're going along? As I said, we're losing some collagen. These are collagen fibers that when we are about baby age to say 18, we're making more collagen than we're breaking down. Right around after that, we start to plateau, and you're pretty much making some collagen and breaking it down, because all of our cells reproduce and they become senescent, and then they go away and they die off too. That's just how we keep living. And then as we get a little bit older, we start breaking down the collagen much faster than we're making it, which is why it gets so much thinner as we lose things along the way. We're also losing bone. We've all heard of osteopenia, osteoporosis. Happens everywhere. It doesn't just happen in your spine or in your hips or in your legs or in your arms. It happens everywhere, including your face and your skull. And we're losing fat. So we really want fat. Sometimes there's a little too much fat going on, and obviously we don't want that kind of fat, but the fat underneath is very important. So this is what the aging bone structure looks like, just to give you a little idea. Take a look at that temple area. That's a really big aging area. When you have somebody that's very thin and you can tell they're getting to a certain point, this just goes right in. Easy to take care of, but it's one big sign of aging. And then if you look at the fat, this is what we have when we're young. You have fat everywhere, which is why everything just looks so soft. This is what we look like when we're older. We're just losing. Especially after menopause, we lose so much fat, just because your hormones really keep that in there. And I don't know if anyone remembers, or if anyone's not through it yet, but when you hit a certain time, it's like the next year, you're like, your face is just kind of falling. But that's why. Also look at the fat pad. This is a nice, keeps some nice puffiness under here, and not puffiness, but just nice and smooth. And there it goes. So what happens is this shrinks, kind of herniates down a little bit. You lost all the fat that you had here, and then you get that big bowl underneath your eye. So volumizing is a replacement of the lost volume. We can do fat transfers. Fat transfers tend to work best when someone is undergoing a facelift, though. If someone harvests from like your backside or your thigh and then implants it, often if it doesn't look perfect, it's hard to fix, because it's hard to break that down when it's in different planes, because as you're injecting, you're going in different planes of the skin. Fillers, we have fillers, thank God we have fillers. We have hyaluronic acids, we have Radius, which is calcium hydroxylapatite, and we have things that can put back volume right away, so you look, more refreshed right away. And we have collagen stimulants. We've had collagen stimulants in this country legally for 8 years? Mm-hmm. 8 years, since 2004. So they have really turned the age of anti-aging around. And so this is Sculptra. Sculptra is the only collagen stimulant we have right now, and probably the only one we need. It's poly-L-lactic acid. Poly-L-lactic acid is similar to the type of material that is used in absorbable sutures. If you've ever had a surgery and underneath it's sewn up, they use glycolic acid. They use lactic acid, and therefore it's pretty natural. If anyone's ever had a reaction to sutures, that is one that we would not use Sculptra on you, but everybody else is pretty much fine. So you're able to naturally turn back the plaque. This is Franca. She was in a study for Sculptra, and as you can see, everything has changed and nothing has really changed with her. She just, to me, she looks mean here. She looks unhappy, and she just looks happy in that final picture. And these results, once you're where you want to be, persist for over 2 years. We know that. And it's not like all of a sudden 2 years happens and you go back to baseline and she's here. She's just not quite as good. So you can just kind of touch that up and grow some collagen back, but she just looks really fresh. Here's another one. Again, nothing has really happened, but everything has happened. She just looks somewhat happier, softer, a little bit rounder at the edge, but not to where someone says, oh, you had a facelift. I mean, it doesn't look that way. It just looks completely natural. So here's what it does. It replaces, this is old collagen fibers that are all shortened and they're broken and they're just not performing the way they used to. And it helps to stimulate that to grow new collagen fibers that are extremely secure, tough, tightly wound, which they are when they're brand new collagen. Old collagen is just stretched out and elastic and not very healthy. And then it refines by making a nice matrix of firmness. And you wouldn't understand this too much, but when I do inject people, I can tell when they've had more than one treatment because it's a different feel. It's a healthier feel. It's a more secure feel in their skin. So here's some results. This is a problem that we all end up having eventually. Everything starts to sag down. Could it be a facelift? Of course. Not everybody wants to go underneath the knife though. So when you just build back some nice new collagen in various areas, you get a nice firmness that just redefines the jawline, which as you can see from that bone structure that we've lost, holds that up, and even makes the lips look nicer. Nothing happens to the lips. We don't put anything in the lips, but they just look nicer because they've got more support all around.
Can I ask a question?
Sure.
How many treatments of Sculptra?
That was 4.
Okay.
Again, just softer. These are from Sculptra themselves too. They're just softer looking fullness without all the little lines around here. There's a nice little line that happens there. This one too, you know, it's a younger patient, but still, doesn't she look just softer?
Yeah.
Yeah, she just looks really softer. This one too, there's nothing really wrong with her. You wouldn't look at her and think, oh, she's still, you know, she dresses up, looks nice to go out. Has a few lines, but you could put like Restylane or Juvederm in there and that would be fine. But look what happens when she just gets some nice growth. Isn't that pretty? Impressive. And she just looks like she's happier, fresher.
She looks younger.
Awake. Again, she has a nice presentation. You don't look at her and think, oh, but when you just kind of refresh her, she just looks, you know, several years younger, but not in a bad way. Just everything looks extremely natural. And this is a problem that I see all the time where we've got the little, this is what I mean when your muscle is starting to grab onto your skin because you've lost that slip of the fat layer. We don't have the fat layer anymore. So this is what the muscle looks like underneath. And therefore it starts to adhere to the skin, and that's why we get this. And that's why we get the lines here, because your mouth is a sphincter like that. And so now your skin is starting to adhere to the muscle because it doesn't have that fat to slip underneath anymore. We can put hyaluronic acid under there for a short time and make that kind of imitate what we used to have, but it's so much better to just do some Sculptra and get everything just nice and soft. And you can see the lips look more youthful. She doesn't look weird. Well, you can see her eyes, but she doesn't look weird, and it just looks soft.
Wow, that's amazing.
Excuse me, one more question?
Sure.
Does it increase the plumpness of the lips, or?
No, it just actually gives lip support.
Uh-huh.
Because if there's nothing up here really supporting it, your lips kind of fall down and become saggy. And so when you actually have some nice support, you actually have lift.
Uh-huh.
Just like if we put a tiny bit of Botox up here, that decreases the muscle downfall, and you can actually get a little bit of lift too for a short time. It's not really worth doing it. But that is, I mean, it's just, everything is just so nice and natural. There's another one.
Wow.
And again, you know, like inside the cheeks here, it's, and nothing has happened to the lips. Still has a couple little lines, but nothing like she had here.
Looks even better on her jaw.
Okay, so what else? Obviously, Sculptra's not it. We need good nutrition, and Anushka's going to discuss a little bit about some good nutrition that we all need. We talked about exercise. Exercise is so important. It's important for not only maintaining your muscles and maintaining your bones everywhere else. The bones just need so much help sometimes, but it's important for your peace of mind. Of course, hydration peace of mind if you go for a walk. How much mind clearing is that to be walking and doing some cardio also? And then you need the right skincare. You can start out with great product underneath, but you still have that top layer, and the skincare is extremely important.